All right. Now let's break down our sympathetic and parasympathetic nervous systems. Remember, these fall under the category of autonomic. So we do not have very much control over these particular functions. Now, you can kind of exploit psychology to elicit certain responses, but again, you are tricking automatic systems according to certain stimuli. We can also stimulate some of these systems through medication or drug use to elicit a desired effect. And I'll bring up some examples of that. So, again, it's two distinct divisions, but they affect the same systems in different ways because they act to balance each other out throughout the day. We go through periods of stress throughout the day. We go through periods of relaxation, and it's just your body adapts to the ebbs and flows of a typical day. And thanks to your sympathetic and parasympathetic nervous systems, you are able to adapt to the changing environment of your day-to-day activities. So the first one, our parasympathetic, also known as our rest, digest, and reproduce system. So what happens here? Our pupils constrict. We have saliva production. So when we are ready to eat, we start to produce saliva, which helps help mechanically and somewhat chemically break down our food for the digestion process. Our heart rate slows down. It constricts our airways. This is interesting because when we think of constricted airways, we think of someone who might be having an asthma attack or someone who's experiencing anaphylaxis. But that is not the case here. When we're at rest, our demand for oxygen is not that high because we don't need that much energy when we are at rest. So your body can shut down parts of your lungs to meet that demand. And we're not overexerting ourselves by keeping a high amount of oxygen coming in throughout the day. We stimulate our stomach activity. So this is when you're hungry and you feel like gurgling in your stomach. And that is your body getting ready to consume a meal. Then we got some functions in the liver here that you can take a look at. Your intestines, which helps absorb nutrients, and we'll talk about that system in more detail. It causes us to urinate. All right. Then there is sexual stimulation in males and females. So it's a very diverse group of functions. But when you remember these three things, you know the general purpose of your parasympathetic. Now, on the other side, we have our fight or flight system. So this is stuff that gets us amped up, gets us excited. Maybe when you are feeling anxious or you're excited for something, your sympathetic nervous system is taking over your body. And rather than constricting your pupils dilate. Your eyes get wide because you want to take in the world because you're stimulated. It shuts down saliva production. It shuts down stomach activity and other digestive functions, because when we're excited, our body does not want to use the energy on the digestion process. So you may not be hungry when you are excited, if you've ever noticed that. Our heart rate increases, so our heart starts to race, and this is where that nervous system input into the cardiovascular system occurs. Airway relaxes because, again, we're excited, ramped up. Our oxygen demand is also increased. So we want to open up more areas of the lungs to accommodate that higher demand of oxygen. Then there's some secretion of epinephrine and norepinephrine, the hormones that make us feel amped up. Then again, some sexual functions going on there, then urinary functions as well that we don't want to go into too much excruciating detail on. So this table is really good because it really illustrates how these counteract each other on a daily basis. And definitely get to know the primary function. So like pupils constrict when it's rest and digest. They dilate when we're fight and flight. And how does your heart rate change? How does your airway change? What happens with our digestive system? Those are very important things to differentiate. As I mentioned, there's certain medications or drugs that can stimulate either one of these systems. So, for example, you might come across patients who are taking certain medications for blood pressure and heart failure. One of the common ones is Metoprolol. And this medication is referred to as a beta blocker. And the purpose of this is to slow down the heart rate. So this is a medication that stimulates essentially parasympathetic functions to slow down the heart. Now, let's look at the opposite end of the spectrum. So things that might increase our heart rate. Let's say someone has taken cocaine, which is a stimulant. Their heart rate is going to probably accelerate on them because that particular drug stimulates the sympathetic nervous system to induce the fight or flight response in individuals. We have heroin that can shut down the airway, and that can result in cardiac arrest. There's methamphetamine, which can do similar effects, increase heart rate, will relax the airways, will dilate the pupils a little bit. So there are ways to elicit either one of these responses. Some for good, again, certain medication therapies, and some for bad, the use of illicit drugs. So make sure you go through this table and be sure to differentiate between rest, digest, and reproduce, and fight and flight.